I'm Gabriela Bobadia. I'll be talking today about the vaccine protocol for swine. So first, let's start off by defining what a modified live vaccine is and what a killed vaccine is. So first, a modified live vaccine is a vaccine that contains bacteria or a virus that is altered and designed to develop immunity against a disease. So this will actually cause no clinical signs. Most of the time, it will come with a sterile dilute. Some of the advantages of a modified live vaccine is longer immunity, and you don't need to revaccinate. However, the disadvantages are that if you actually utilize a modified live vaccine on a pregnant animal, it can cause abortion. As you can see here, I have an example of a modified live vaccine. So as you can see, the sterile dilute comes with it, and typically this vaccine is used to prevent a respiratory disease in cattle. And a kill vaccine is a vaccine that contains an inactivated or killed antigen that is not able to replicate within the animal's body. An example of this would be the rabies vaccine. Some of the advantages of a kill vaccine is that they can actually not cause any disease, not even in those animals that are immunologically compromised. And then the disadvantages of a killed vaccine is that they do need to be revaccinated, as we know when we take our pets in for the rabies vaccine or any livestock animal. They do need to come back at a certain time. It could be annually, 3 years, depending, and they have to come back to be revaccinated. Another disadvantage would be it can cause a hypersensitive reaction. So here we have a timeline of important times that piglets need to receive vaccines, injections, other things that they would need before they are slaughtered. So typically, swine will be slaughtered between 6 to 7 months, and they'll typically weigh about 250 to 300 pounds. So for the first few days of a piglet's life, between 1 to 3 days, we will give an iron injection, and this can be given subcutaneously or intramuscular. This can also be given orally. However, they will most likely receive an iron injection, and the reason they do receive this is because they are prone to iron deficiency, especially because piglets have yet to develop their immune system. And iron deficiency can lead to anemia, which can lead to death. And then when they are 7 days, they'll receive a vaccine for the atrophic rhinitis, erysipelas, mycoplasma pneumonia, and atrophic rhinitis. I want to refer to it as AR. So this is an infectious disease that can lead to the deformation of the nasal turbinate. And then for erysipelas, this is actually a bacterium that causes skin lesions in swine. This affects our carcass. And then mycoplasma pneumonia is an infection that actually affects the first 3 weeks of a piglet's life. And then within 4 weeks of a piglet's life, we'll actually repeat those vaccines, and we will vaccinate for Actinobacillus pneumoniae, which is a respiratory disease known to cause actually severe economic loss in the swine industry. And we'll repeat this vaccine later on, 10 to 12 weeks. However, between 4 to 10 weeks, we would ideally want to deworm our piglets. However, withdrawal time depends on what dewormer you end up using. So what are the administration methods and locations? So for the iron injection, as mentioned, we can give this subcutaneously or intramuscular. Typically, it'll be behind the ear, the hind limb, or the inguinal fold. Atrophic rhinitis will be given subcutaneously or intramuscular as well. It can be given at any injection site. However, withdrawal time is 21 days. Erysipelas is administered orally, and then withdrawal time is 21 days. Mycoplasma pneumonia is intramuscular. it will be given intramuscular, and the withdrawal time is 21 days. Dewormer preferably will be given orally, but it can also be given subcutaneously. Withdrawal time just depends on which you end up using, like which brand, which form of dewormer. And then Actinobacillus pneumoniae will be given intramuscular. It can be given at any injection site as well. There's no withdrawal time for the Actinobacillus pneumoniae, and there's no withdrawal time for the iron injection. That's only once given between the first few days of a piglet's life. And here are my references.